Welcome to Sports Doc Talk. I'm Will Sanchez, along with Dr. Grant Garcia, our orthopedic surgeon, sports medicine specialist. Dr. Garcia's, I had to take out my Allen Iverson
Dude.
slam short shirt. We're talking a little basketball. We're talking a little rehab. We're getting into everything. With 12 months out of the year, we can talk basketball. But before I get into all that stuff and introduce our guests, Dr. Garcia, how are you?
I'm good. I'm good. Things are good over here. It's summer in Seattle. Can't complain. I'm really excited for our guests coming up. We've talked at nauseum about ankle sprains and how long the issues with them and the recovery process. And on our football updates, we're always like, "Well, when are they getting back? I don't know. I don't
Yeah.
know." It's a huge. It's probably it. It goes through every one of these sports, and it's not above that. And for the NBA, so I'm really excited for this.
Yeah, so am I, and someone that's had major ankle injuries as well. We probably could have used some of that technology and some of the things that we're going to talk about. But we're talking about injuries, so we're talking about recoveries. Let's give a shout out to our folks there at the Recovery Shop.
Yeah, so special thanks to Mike and those guys for Cover Shop and their sponsorship. Again, like I say before, this is maybe something that you can eventually find Betterguards on. But the idea behind here is that for people that are recovering from something or some sort of rehab ability, you can use this, especially as a surgeon, to kind of keep everything put together for your patients. They're always asking, what more can I do? What better can I do? How can I protect myself? And this is your option. So it works great. It can be customized, and the patients like the personalized experience, similar to something we're going to show in a minute.
All right, let's not waste any more time. Let's bring in our guests. We're really excited to have our guests. Keke Lyles, thank you so much for being a part of the show and being with us and sharing your knowledge. I will do my best to keep Dr. Garcia under control. He likes to ramble a lot.
Love
So
it.
yeah. So first and foremost, what are we thinking about the Allen Iverson shirt? How you feeling about that?
I love it. I miss the old Slam magazine. Obviously, that's what we grew up on, right? So,
Yeah,
yeah, I'm
That that
loving it.
that was kind of like the Fangoria for sports fans, basketball fans. I don't even know if Fangoria still exists. And as you see, I digress. I go off onto different tangents, which is one of the things that gets me in trouble here. But let's talk about your career. We have so many things to get on to talk about. But you've worked with some of the top athletes in the world. You have NBA experience. Why don't you just give our folks, our listeners, our viewers a little bit of a background on the things that you've done and will lead up to the things that you're doing now.
Yeah. Well, first, appreciate you guys having me on as a guest. So excited to have this conversation. Yeah, my background, doctor in physical therapy, grew up playing sports, and really is when I was in PT school, I started working as a strength and conditioning coach for the university. I went to Northeastern out there in Boston.
Mhm.
And it was during that time when I really started to develop this idea of, like, especially in athletics, like injuries and performance is really on a continuum. And especially during a season, we're either trying to optimize performance or maybe recover from an injury. And so it's kind of all along that same continuum. And I love technology. I love trying to understand things at a higher, maybe a deeper level. And so I've always been attracted to different tech, different data sets to inform my decisions or kind of my hunches, and have kind of built a career around that, I suppose. And so fortunate after grad school, got on with the Minnesota Timberwolves as a head S&C coach. After a few seasons there, went to Golden State as director of performance. I had obviously team success, winning a championship in Golden State, which I think opened up more opportunities for me. And eventually went to the Atlanta Hawks as executive director, kind of overseeing everything: sports medicine, sports performance, sports science, you name it, and try to build out systems in place that we can assess our athletes, try to understand them on an individual level, and build programs to help them achieve their goals.
I think it's important for our listeners to see that we're the person here who's going to talk about this product we're going to talk about. This is not something where you just all of a sudden showed up and decided to do this. It's you lived it, breathed it. You've had to deal with injuries to all those sort of high level players. And with the professionals, we keep talking about these injuries, right? Like one day out is a lot of money. 2 days out is a lot of money.
Mhm.
It's a huge investment for the team. It's also hugely dissatisfying and frustrating for the players. So I think that this is a great setup to kind of the next steps.
Yeah, and I think honestly, I mean, obviously you said it, all sports deal with ankle injuries, but any injury to your point, like our job is really to try to prevent as many as the, kind of preventable injuries that are out there, soft tissues, overuse injuries, things like that. But some injuries are unavoidable. And when that happens, our job is to get the player back as quick as we can. So we kind of look for anything and everything that's going to help us in that process. And over the years, since being with the NBA team, obviously meeting Betterguards and the ankle brace company that we're going to talk a little bit about, like it's just a game changer, not only helping prevent the injury from happening, but then also speeding up the recovery afterwards.
Awesome. So what we kind of hinted at it, people have seen in my background, they saw it on the intro, they're going to see it on all the blasts, but tell us how you got to that point, and then I kind of want to show off the product really quick with the video, and then we'll go back to doing more questions.
Yeah, so after departing with the Atlanta Hawks, moved out to Southern California, where I'm still at, and worked with Navy Special Warfare, and started consulting with teams and individual athletes. Did some projects around with the NBA league office as well, and that's when they started the Launchpad program, and that's how I got introduced to Betterguards. And so when I first met that team through the Launchpad program with another company I was working with at the time, advising, I just immediately was like, oh, where has this been? I got super excited about it, obviously, and started advising, working with the team, and really just trying to get it out in front of as many athletes and get feedback. And obviously they're coming out with their 3.0 brace. So, they do a great job of taking feedback from athletes more around the comfort than anything, and making it more and more comfortable, which, is just a testament to the company, because I thought the version 1 was really comfortable. So the fact that they're on version 3 already is pretty awesome.
Well, and I think one of the negatives of all these braces is you can constantly hear, like, it may be high stiffness, but maybe not in this case. We'll show that in a second.
Yeah.
But really, it's comfort, right? And a lot of the players don't want to play it. It's just like ACL braces. Like, if you're not going to get a player to wear an ACL brace, they're not comfortable. And maybe they protect you, but they're not comfortable, and you're not going to play your highest performance. So it's a really important point.
Yeah, and to be honest too, I mean, obviously in Golden State working with Steph, like, and through some of his injury stuff, like, I mean, the comfort of the brace is going to be probably more important to the player than the function of the brace, and that's just the reality of it. And so you may have the best brace in the world, but if the player, to your point, if the player is not comfortable wearing it, they're just not going to wear it. And so there has to be a perfect balance of comfort and function.
I think that's an awesome segue. Will, pull up the video, and then let's go back.
You got it. Great video. Yeah, you're seeing the flexibility. You're seeing the jump. I used to jump like that many moons ago. Not really.
You catch like that too, right? You got.
Oh yeah. Well, to be fair, with the gloves that they have now, any of us can pretty much catch. But I don't want to get in trouble with any of these athletes here. But anyway, go ahead.
Anyhow, so I love the video. Obviously, it shows you got the next step, right? You see someone actively using it, in addition to the fact that they're playing football. They're able to do their thing. So we obviously are not talking about football today, but the promo video is a good setup for this. So maybe Keke, you can kind of explain to the viewers and stuff kind of what this is, because here, this podcast, we get a lot of guest requests, and we don't take many of them because the focus is on sports medicine, rehab, and athletics, and how it all mixes together. And how can you make my job easier by not having to constantly fix these ankle surgeries and or deal as a team physician? As you know, you worked with, I'm sure, all the team physicians for those teams. They're really good guys, but it's a pain in the butt, right? Like double time of rehab. These ankle sprains are not fun to treat. right? It's
Yeah.
just, you can't fix them all the time, and you're just waiting and waiting for them to recover. So kind of talk about the Betterguards and your stuff.
Yeah, I think so. One of the things that really stands out and is unique about the Betterguards brace is that it's actually quite flexible, and I have one here, so I can just show. Like you can see, like it looks
Wow.
like
Yeah,
a,
that's super
you
flexible.
know,
That
it's like
doesn't
a
look like,
compression
yeah,
sock.
that looks crazy.
Yeah, and so like when you put it on, it really feels like a compression sock, which is great. I mean, because it allows freedom of movement, and so
Will,
I
put up
know.
that slide while he's talking.
Yeah, and
Keep
I
going.
know when I grew up playing sports and had my fair share of ankle sprains too, like I used to wear the really thick ankle brace that pretty much restricts all movement. And even as a kid, and yeah, I just
You
didn't
mean
like
this
it.
one?
No, even well, those are pretty bad too. But even though the like the ones after you have surgery where they're just plastered on the sides, you can kind of dorsiflex and plantar flex, and that's it. And so I think having this freedom of movement is the thing that at least the athletes love, because it's like they don't feel like they're wearing an ankle brace. Now the protection, their tagline is it's a seatbelt for the ankle, and you can see it in the picture there. But what it has is, and the technology is pretty cool, is this little
Will,
piston on the side there.
go to that slide. There's a slide there. I want to show the viewers this. This is cool. Yeah, I mean, you guys can see really quick. We can see all the people that use this. It's pretty freaking awesome. So,
Yeah,
and all those other
it's
things. But go to the tech. The tech slide is really good. Keep going.
Oh, with the
That one
different
right there.
braces. Oh yeah, here we go. So here's like the magic is that little piston. And so even the one I'm holding, like you can kind of pull it out and it's not that big of a deal. But when you go fast, it locks up just like the seatbelt, right? You can pull a seatbelt on nice and slow, buckle it in.
Oh,
But when you go to pull it fast, it locks up. And so that's the idea here with this little piston, and how the brace works is it allows freedom of movement. But when there's a sudden roll of the ankle, quick movement, then it stiffens up and protects the ankle. And so that's really what sets this brace apart. It's really unique and obviously genius design by the group in Germany that created it.
that's
You
awesome.
know,
And then, so like in here, it looks rigid only because of the way you guys had to make it for the 3D, but your one is like so soft. So it's like almost like a sock kind of material. You said neoprene. And
Yeah.
then it has that one hinge for
Yep.
the piston.
It has the one piston, yep. And what's different, I was talking about the different versions. Like you can see here, like where this little bracket is. Like some athletes would complain like they could feel that bracket, and so they've moved that up on the 3.0 just to make it more comfortable. So it literally feels like you're just wearing a compression sock.
Awesome. And
that's
then yeah, keep going while you go.
yeah. I just want to kind of bring it up. Was some of the inspiration or any of those conversations? Obviously, you dealt with Steph Curry, right? And he had, I mean, he's probably besides Grant Hill one of the most famous athletes that I can remember that we actually considered or was concerned that he may not have a career because he had so many ankle injuries. Davidson, 2011, he had a bunch of injuries. 2012, I believe back to back years he had the surgery. While 2012 they went in, they cleaned everything up, and there were a lot of concerns. So working with him, working with the team doctor, everyone involved. Was there some inspiration on that where you saw firsthand, like these are the problems that we're dealing with, and with my expertise, I can give that feedback to a company like this?
It was a little bit of that, although by the time I met Betterguards, they had already designed it, and so I was more of like the assurance of like, yes, this is going to make a difference. Just working with all the guys that I've worked with, like wishing we had this back, in 20. I joined the Warriors in 2013, so right after Steph really had all his surgeries and everything, like we were exploring everything on the market back then, obviously, and that's what you do in the team setting. Like you kind of have to leave no stone unturned. And so, yeah, I wish I had this. Like I said, when I first saw it, I was like, this is a no-brainer. When you put it on, feel it, start moving around, feel the protection. And I think that's why they're having this success. Like, I mean, it's blown up really in the last year. I mean, it's going off like gangbusters now.
Mm.
KK, will you describe to the viewers, I could do like the surgical side of things, but I think from you being the performance coach, like you guys, I mean, this is actually a really cool side conversation that we can have with the viewers hearing this, because what they don't understand is that the conversation between the team doc like myself, and the performance coach is actually really vital. And we do that a lot behind the scenes, as you know. I mean, you probably spend more time with the doctors than you even do with the players sometimes. Like,
Yeah.
hey, what do I do here? I tried this. It's not working. What are your thoughts? This is all a team collaboration. And it's funny. Most of the teams think the docs do all the work, and they do like very little comparative to people like you. Like, you do most of the work, and you're the one that's like doing all the titrating, and you're like the chemist, right?
Yeah.
And I come in, I'm like, hey, listen, may not surgery, may need surgery, but you're the chemist. I'm like, what do you think?
Yeah.
It's always like you're the ones in charge. So it's
Yeah.
really, so how would you, so before this, how would you rehab or try to prevent ankle injuries, these sprains, because they're so common? And then let's talk about after.
Yeah. So I think, yeah. I think you're right. I probably did have more conversations with our team docs than the actual players. And part of that is, we're working with the athletes every day. And so we kind of have an idea of their strengths. Well, we better have an idea of their strengths and weaknesses for sure, but how they're moving, how they're responding to different things that we're throwing at them. And so we kind of have that intimate knowledge. And then we have, obviously when the team docs gets involved, it's like, okay, this is what we're seeing as a performance staff or as the medical staff on from the team side, right? And we're saying, hey, we may look at force plate, we can look at balance, we can look at, use all the technology in the world, and then use our eyes on the court. This is how they're moving, this is how they're responding. And then when we kind of have this conversation with the team docs, it's really about, okay, from a medical standpoint, what can we do? What are our options, right? Surgery, yes or no? Is it some sort of orthobiologic, some injections or something like that, right? That can this help or that help? And or we bring in a podiatrist, and what can we do to the footwear? What is his current footwear or her current footwear, and how's that affecting their kind of biomechanics? And so what we try to do is have this really holistic picture of like, okay, here's what we think is the problem. Here's ways we can address that problem. And depending on, the athlete, where they're at, where the injury's at, we may be super aggressive or we may be super conservative. And so that's part of the conversation as well. And so we take the plan, we go back, we implement the plan, and we start working on it. And then, depending on how the athlete's responding, we're going to have to adjust. And sometimes that goes well, and sometimes it doesn't go well. And so, an example is we may know surgery is an option, but we may not want to go there first, right? And so we're going to try some of the other exercises and kind of building up, you asked like what we did before this, and it's really building up like the foot and the ankle muscles, but it's also like the whole kinetic chain, like all the way up. How they're using their movement strategies. Do they load their hips, or are they very knee dominant? And all these things that how someone moves will determine, our intervention. And so sometimes that intervention works, but when it doesn't work, we say, okay, I think we need to go to surgery. And that's where having the team docs involved in the process, because they know what we're trying. They kind of sense, hey, this is probably going down the right path, or hey, this is not really going down the right path. Let's jump in now. And I think with athletes, it's like, if you have to have surgery, then you want to have it sooner than later, but you don't want to have it too soon if you don't have 100%. To have it, right?
So well, I think that's an important point too. That's a really important point for people to hear, right? From because they can hear it from me, but hearing from you, like when to do surgery sometimes is really challenging decision making too, right? Because they want to get fixed, they want to get back on their contract or win the championship or whatever else they're going to do. But you also don't, that's the art, right? That's the art of working with guys like you to decide if this is the time to pull the trigger. And, all these sports docs you see that come out of school and they're like, I'm going to be a sports surgeon. I got this. And then you get to like team coverage and you're like, whoa, this is totally different than what I learned, right? Mm-hmm. Like the book answer is like, if you tear this, you fix this, not in professional athletes. It's a whole nother, there is like a different category, which there is no book written for it. And it's feel and it's learning with your team. And it's why like, it's funny, we're used to the operating room being kind of like control of the thing. When you're on a team, like the team doctor is like, let's talk to all the other people. Like, you guys tell me what we need. I'm here as a resource. You got to put your ego down when you work with the professional teams. And it can be challenging for some surgeons. So the important part is to like, it's a team environment. But jumping a little forward, so talk about what do you think now with, people still probably get some sprains of this, maybe not. We can show the data. but like, have you noticed, like, we'll look at the data in a second, but what would you say now? Like, I know you work more with the company, you've done a little less with the teams in the last few years because you've done more of the consulting, but what do you think a team now having this product would feel in terms of their rehab or how they're feeling? Like, is a product just if you sprain your ankle? Is it a preventative thing? Use it for both? Or like, what I care about too is like, you sprain their ankle, let's say the player doesn't want to use it, right? They're like, I don't want to use this new product, which again, some people might want to. So they sprain their ankle or they injure their ankle, and then do you use this afterwards too? Like, what are the uses for it?
Yeah, so definitely a couple good points there. You know, being a new product, you can imagine, especially professional athletes are like, there's a handful of guys who are just like, no way I'm wearing that. It's new, right? And so they had to find the right players who were willing to try it and give it a shot. And that's been happening over the years. And I think that's why I'm saying like there's been a lot of growth this last year, because now like players and athletes across leagues have been using it and getting more and more comfortable with it. And I think, you know, the biggest thing is what you see is, yeah, you can still, obviously, if you land on someone's foot, right, even if you're wearing this, like you could roll your ankle. But what we're seeing and what the data showed is like it's a major reduction in severe ankle sprains. So now, you know, potentially what might have kept you out for 4 to 6 weeks may only keep you out for 1 to 2 weeks. And obviously, you know, that's huge for us. Like it's huge for the athlete. And then the other part is yeah, if an athlete really doesn't want to wear it, you know, as a protective mechanism, they can certainly wear it post injury. And the reason that's valuable is because it gives you the natural mechanics and the freedom of movement. Like you're not compensating, you're not developing an abnormal movement pattern. And so you get the protection of, you know, the athlete feels the proprioceptive protection of the compression. Obviously the piston's there. So if they were to roll it, it's protected. So that's why they're seeing an increase in return to play from a normal compared to not wearing it post injury.
Awesome. So yeah, so can I ask clarifying? So you're saying, let's go, because let's try to convince more people on this show. Like what's better, right? Like the players that are already using it, they know it's better, right? That's the easy one. Like those aren't hard sells. But the players that aren't using it or the people that aren't using it, so you get, let's say we can already show the reduction in risk injury, and I want to talk about that. That's an easier discussion. But let's say you get injured. So if you were the performance coach, let's say you're back on the Warriors, right? Player gets injured right away. They injure their ankle. They're the ones that didn't want to do it. And you don't want to say, I told you so. But you just want to say, hey, here's what I would recommend. So how would you rehab a player now with this brace?
So as soon as they injure it, we'd get them in the brace and have them wear it just all the time, walking around, everything, you know, and depending on, again, depending on the severity, you know, if they're not walking yet, they can still wear it and develop that confidence in it that it's going to protect them. And that's what the study showed. I think it was 54% faster return to play with wearing the brace after the injury. And so after someone gets hurt, 54% faster. So you're essentially half the time, right? And that is huge for any athlete to get back. And so I mean we're still going to treat it the way you would treat any ankle sprain, right? You're going to do all, you know, whatever you have access to, you're going to do what you normally would. We're just adding the brace on.
Do you see, again, I know you work with a company, right, not on the floor giving these out every time, but in what you've heard anecdotally from the athletes, this 54% return to sport faster, do you feel like they're meeting all their checklists? Like, is that what's getting them back faster? Like, hey, listen, you no longer have pain in there. You're able to run with confidence. You're not limping, right? Because there's always a return to play protocol for all these things, concussions, ACLs, you name it. So are they basically, you're saying that they're checking the protocol faster with this, roughly?
Yeah, right. Yep. Yeah, that's it. And I think the biggest thing, like when you compare just anecdotally, like in my experience, before kind of Betterguards, you know, this like early 2010s, like when someone rolls their ankle sprain, you know, rolls their ankle, has an ankle sprain, you know, around like the 3 or 4 week mark, they're feeling pretty good, but it's always that last like 10 to 15% that just seems to drag out forever. And I think to me, that's the biggest thing that's changing is like, this is all happening much quicker now. And you hear athletes use the word, like, I just feel so much more confident in it. And so I think that's a huge aspect, like, because it's protecting them, because they have their normal kind of biomechanics at the foot and ankle, like they just are confident in returning to play. And I think it just gets them over that last 10 to 15% much faster than what they previously did.
Great. So you're just going to see less long haulers. I mean, we've seen these. NFL is notorious for it. NBA is notorious for it, right? The guys are like they should be back. Like you see the
Yeah.
ankle sprain, you're just like, Will and I have talked about this injuries. You're like, is this going to be a 1 or 2 weeker? Or is this going to be a 6 weeker? Is this going to be half the season? It's crazy because it for injuries that I deal with, it's kind of on a minor level, right? Because it's a sprain, but
Yeah.
they're so frustrating to take care of, and so there really hasn't been a good. I mean, doing surgery is all great, but you're out for a while, and like you can't just do surgery on everyone. That's not the right answer, right? So like, and you
Yeah.
can pump them as much biologics as you want, but it's still not the answer. I mean, we Will heard us say so many times, prevention is by far the best medicine for injuries, right? You can prevent it. If there's something you can prevent, if I had something to prevent all my injuries, I would give it. Like if we had a better brace for ACLs to prevent tears, the data's not there yet, right? Like skiing and I think MCLs in linebackers or in linemen. But this is pretty awesome. We'll pull up that. I want to talk about injury prevention now because we're kind of talking about it, but I want to run through that number, that 40%, or I think there was something like that up there.
Yep.
Can you pull that
Yeah.
up?
Yeah, and as you're pulling that up, the one thing I'll tell you, sorry, like we had a guard who was a chronic ankle sprain, guy his entire life, and I'm sure you see this, and I'm sure people listening, there's going to be a handful of people who like just sprain their ankle over and over and over to the point where there's no integrity of the ligament anymore. And we had a guard who came down on someone's foot in the middle of the game, and his lateral malleolus, so the bone on the outside, hit the ground. I mean, he rolled it so hard that it hit the ground, and everyone heard that and we thought he just broke his ankle. And so at that point, like, what kept him out was the bone bruise, not the ligament damage. And so that's the other part of this is like, if you just chronically are spraining your ankle, like the integrity of the ligaments become
Gone.
useless. Yeah. And now you're dealing with these bone bruises because when you roll the ankle, the bone is hitting bone, and that's usually their pain, and those can take forever. And there's not really anything you can do with bone bruise other than like we kind of just deal with it, and eventually you got to work your way through it. And so that's another reason, to your point, like prevention is so key, because it's like if you get to that point, it's just really difficult.
Well, and also the surgeries are long; they're not always successful. This might be a good segue, Will, at some point to have our in-house Dr. Yee on the episode to talk about this for the foot and ankle. But like, it is a good point you're making. I mean, right? You have when your ligament's torn, it's no longer there. You basically are adding another ligament. I don't want to oversell the product with the piston, but the idea behind that is like, that's a cool. I'm sure that's not like a super common injury. Like it's common, but I'm sure it's not like so it might be hard to study. But the idea behind like, it's more than just about ankle sprains, right? Only the public only sees ankle sprains. Like we all know this. Well, we've seen this on the injury report. The injury report's like, yeah, he's got a knee sprain. It's just bull. It's not a knee sprain. There's something really wrong with his knee. They just don't want to mention it. So it's like he's got an ankle sprain, but he may have much worse than that. He may have a high ankle sprain. He may have a bone bruise there. And obviously that scares the people, or it can change the whole perspective of the team. But there is more that these can prevent than just that alone. Do you say like, so if someone has this, would you recommend both sides or just the injured side? How does it work for you guys? Like when your players have done it, what do they usually do?
Yeah, I mean, there are some athletes who are just really concerned about one foot, one ankle. But the idea you said it, and that's what we preach. It's prevention. So it's like, why would you not wear it in both? And I think, traditionally what athletes are used to are these more bulky braces. And so for them, the idea of wearing on both, they're like, I don't want to do that. Like, forget that. But then once they try the Betterguards and they're like, oh, this is comfortable. The adoption to using on both seems to be much higher.
But what's the best feedback you've gotten from a professional athlete wearing the product, with someone, whether word of mouth or directly to you, where you went, man, that was pretty good?
I think for me, honestly, it's just hearing every athlete say, like, it feels like I'm not wearing an ankle brace. Like I'm not, it doesn't take up all the space in my shoe. It just feels normal. And I think and at least when I hear like an athlete say it feels normal, like that's huge because I want them to be comfortable. I want them to express their athleticism, do everything they want to do. I don't want them thinking about, oh, I have an ankle injury or an ankle problem, or I got this big bulky thing in my shoe that I have to worry about. So for me, that's huge.
Across the board. So you can wear this with low, mids, and high, right? So
Yep.
it doesn't matter if KD has a line out and he's got some mids on, or somebody's wearing high tops, which I'm not seeing a lot of high tops, but that's a whole other
Not anymore.
conversation.
Yeah.
This a low. So this ankle protector you can wear with any kind of shoe. So if they have endorsements, sponsors, it's not going to affect them because it is not bulky. It'll fit with anything, right? So that has to be a plus as well, because now we're talking about money, sponsorship, your own brand,
Yep.
sure, right? We're thinking big picture when it comes to something like that.
Yep. Yeah. I mean, it's funny that you mentioned some of the sponsorships because even like the early adopter players in the NBA, that was a big talk of like where the Betterguards kind of logo is. Can it be shown? Can it not be shown? Like there's lots of rules around that.
That's
and
crazy.
So, yeah. But yeah, you can wear it with whatever you want. And I actually had a guy that I was working with just 2 years ago. Who had an injury. Like I think most athletes, like when they're at home, right, they want to wear sandals and everything, and it's like just wear the brace even when you're wearing your sandal, like
Yep.
just wear it. And so for them, they thought that concept was foreign, but then they loved it, and they saw the results, so that always helps.
Are you doing multiple colors for, like, let's say it's Golden State, you got the gold, or are you doing things like that? The Bucks, green and purple?
I
What's
know,
the next step you move to?
Right now, it's white and black are the options,
Yeah.
and mostly because especially at the professional level, it's a lot of like color of the socks and team socks, what's allowed, what's not allowed.
Yeah.
It's more around that, but yeah, I'm sure as the company continues to grow, especially like for youth, it's going to become like style. So for sure.
KK, one thing we noticed, we talked about the Guardian helmets on one of our episodes, and some of the things how the NFL now is saying, hey, listen, you know what, like you probably need to wear this, and like they start recommending it. Like, what do you think the data is going to have to show on this thing before? I mean, like if I'm a team owner, right, and I know that my players had 6 ankle sprains and they refused to get surgery, and I just paid this guy 20 or 30 million dollars a year, and he doesn't want to wear a brace that's still a relatively reasonable cost. When do you think the owners say, you know what, it doesn't really matter if you don't like it or you don't want to
Yeah,
use it? Or I'm
I
not
think
saying that not like it, but like when does
yeah.
that, but like at some point some of this technology comes in, right? We know about this. It sucks. But then when the player gets kind of forced into it, but like if you guys eventually show that, I mean that would be obviously amazing for you guys to have that sort of reputation that it's so good that the owners think you need it. But like that could be a situation where you're a Detroit coach, like, listen, are you tired of getting ankle sprains? Like, you're going to be out of commission more. Like, you need to try this. Like, you don't want to lose any more money on your contract.
Yeah, and yeah, it's an interesting question, and that's where it's like you got to get the players' union kind of behind it as well. There's one NBA team that does force players to wear ankle braces and like knee pads for practice, and there's a lot of pushback initially, but now it's the culture there, right? I've been involved with conversations with players that previously did not wear any sort of ankle protection, who've had recurrent ankle injuries, and it's like, okay, ownership does get involved and say, hey, we got to do something, right? Like nothing, like we can't no longer do nothing. So let's work with the athlete to figure out what's going to work. And I think Betterguards is going to ultimately start winning a lot of those kind of conversations because, again, if an athlete who doesn't like wearing ankle braces puts this on, it doesn't feel like an ankle brace. And so now they're like, okay, I'll try this.
We'll pull up that slide to show the comparison. I mean, I know we kind of talked about this in nauseam, but you can do like the mobility, high, low. One more. Keep going right there.
Yeah.
So you can see, I mean, this is what we have option wise, right? Like, I mean, there's some fancier looking ones, but nothing does what this does. No one has, the key is you check off all the highs, right? High protection, high mobility, high comfort. You have to have all of those. The problem is it's really easy to get the second two if you have no protection.
Yeah,
So
exactly.
you can do, so you got to have, it's the mix of the two. And so, like when a player's looking at this, right, that's their alternative option. So it's a huge niche too, right? Like underserved, which is why I think the technology is so cool, and having you on here discuss this is really cool, because it's something we talk about and we have not seen anything in the news or anything that's been able to way to like help this. And the negative of ankle sprains is that they're not like sexy, right? Like the Tommy
Yeah.
John surgeries or
Right.
like the, ACL tears. So they don't get as much publicity. But right now you can see it right here. But the big data shows that obviously it's a problem. I mean, one in four NBA players injure their ankle each season. That's
Right.
crazy. And it's the most as I mentioned, like if you just take, it's agonizing how many of these you see.
Yeah. No, and that's the other thing. Like a player may kind of sprain their ankle, and it might be a pretty minor sprain, and they miss a week, and you don't think much of it. But then it happens again. And to what we were talking about earlier, it's like these recurring ankle sprains, and how much worse it gets each time. And so, I think a lot of people think of it like the first time anyone sprains their ankle, it hurts, right? Like they're crying, it hurts so bad. You ask someone who's like sprained it the 10th time, and they're like, "Yeah, it's not as bad," right? And it's like that's not a good thing. That's much worse than what people think. And so, yeah, I think there's obviously a massive opportunity to help athletes across sports to kind of get ahead of this.
Are you
I'm
seeing
getting
any? I know we're talking about the ankle, right? But the big conversation this past NBA season was the Achilles,
Yeah.
right? And is there any data or anything that leads up to, like, let's say if you have a bad sprain on your right ankle, and obviously Dr. Garcia is right up your alley here, it's right, spraining your right ankle, it's not healing right. Now you have some soreness in your calf, and now you're leading into other injuries. Is there any data that kind of shows any correlation with that? And I know we're talking apples to oranges as far as the injury uptick that happened this season. I believe it was 7 NBA players had Achilles injuries, 9 altogether, including the 2 players that got hurt in summer ball. I forgot their names. So I don't know, or am I going off on a whole
Well,
different
you're going off on a tangent, but
like I always do?
you're helping with a question. Would be, I would rephrase it because it was well put, but I would add a question in there to say, is there a future for Betterguards piston and other opportunities? I'm not trying to give away your future R&D,
Yeah.
but the idea is if it works that well in the ankle, why the hell wouldn't you use it in other places?
Yeah. So I think to answer both of those, um, I don't know if there is clear data that shows ankle injuries to like Achilles injuries, but for sure, like there's plenty of research that suggests after an injury, movement patterns change, which then,
That's
can
100%.
affect more other injuries, right? And so I think there's a link there for sure, to some degree. Not to say that all Achilles come from prior injuries, but for sure. And that's why, restoring normal movement is so key. And that, again, that's why I was personally excited about Betterguards. And then, yeah, to your second question, yeah, they're already exploring the pistons in different like knee braces, elbow bracing. There's lots more opportunities to kind of apply this technology to other joints.
Yeah, this is cool. I'm already thinking about some things in my head. I like the MCL. I like some ACL stuff. I mean, if you have a brace that smooth, and then you've got an acute piston thing, like that is pretty sick. It's funny when I looked at your product, I saw the piston and I learned about it, but I didn't really get it until you showed it. So today is pretty cool. It's a little eye opening. So hopefully for the listeners too, they can see it. I mean, like I said before, like the idea of putting, like, to me, like I put on these ankle braces before, the old ones suck, right? Like the stiff ones, they're like this. I wouldn't wear it. Like I'm like, but if I had something, I'm going out and I have a loose ankle. The other thing is like a lot of people don't want surgery. I mean, no offense, but like I do a lot of surgeries, and like you just don't want to have surgery on your ankle. Ankle surgeries are hard. They take longer to recover. The blood flow is different down there. Listen, I have tons of friends that have had ankle surgery. They do well sometimes, but sometimes they don't. And so it's like, yeah, if someone's like, well, why would you just do the ankle surgery? I'm like, it's not 100%,
Yeah.
right? So if you have something that's preventative, like I'll be honest with you, if there was a brace good enough to stop people from dislocating their knee with ACLs, there probably would be less ACL surgeries, right? Like
Yeah.
people don't want surgery. They'd rather wear a brace if it's comfortable. And so another point you made, right? That person with the chronic ACL, the chronic ankle, they probably should have gotten surgery, but they're not ready to. They're an NBA player and they don't want to take the risk. So like that's another important point. Or athletes, they don't want to do anything until they're done with their career. So that's even more important.
Yeah, absolutely. Yeah, it's funny, you know, coming from physical therapy background, like I think myself, but I'm sure plenty of others, like view surgery as like a chance to reset everything. Like sometimes there gets to a point where it's like you need the surgery, you need to reset, but it's like you have to put in the work, right? And it's like the rehab is, just as important as the surgery. Like if you just have surgery and do nothing, it's like usually those patients don't do very well.
Dude, that's exactly right. Like I spend my time in the office. I'm like, my job is like an hour or 2 hours. Maybe I
Yeah,
talk to you a few times afterwards. And then all the work is done with the physical therapists and strength conditioning coaches. And so you
yeah,
don't put the work in. You know, have patients, same surgery, same surgeon, 4 different patients, same day at the office. 2 are killing it, 2 are not killing it. Exact same technique, right?
yeah,
There's a reason. There's a lot of reasons there, but one of them is the work. There
yeah.
is a really there is a difference, and it's hard, and you get to the bottom of like, and they won't bring it up with you. Maybe you in the professional level they tell you, but in that 1 or 2 instances, if you're seeing them, they might not say, "Oh, I stopped doing my stuff. I only do it once a week."
Yeah.
Right? You're like, that makes sense.
Yeah, and I think that's the big difference between professional athletes and general population. Like professional athletes, like they have teams of people to take care of them and making sure they're motivated. Obviously, it's their job to be out there performing. Where the general population, like you might see a physical therapist 2, 3 times a week post surgery. It's just not the same level. And then life gets in the way. You're busy. I got school. I got that. And then now, next to your point, like you can have the exact same thing and have some patients do really well and other patients do really poor. And so it's like if you can just avoid all that to begin with, it's so much better off.
Yeah. Well, and I actually think it's much the professional stuff's super sexy to talk about. Like you hear the word NBA on a podcast, and you're like, oh, this is interesting, right? But like to be honest with you, this is probably gonna be more important for non-NBA, right? The
Totally.
kids, right?
Yeah.
Because like Curry's talking about Davidson, right? Like that's before the NBA. So like you have like this is the end. Once you got to the NBA, you like we've seen this in Tommy Johns. I do players all the time. These young high school players, they have trashed UCLs, right? Like, can we prevent these before that even happens? So like, is this kind of like the concussion protocol? Like, let's get these ankle sprains down at the high school level, And I think that's something has. What's Betterguards' thoughts on sort of the education? Obviously, they're doing well with the marketing, the products. They've done a good job with the design. Like, how does that work? Because like that's a hard part, right? Like you can only market so much, but you really got to get the buy-in and the lower down
Yeah.
athletics or the high school athletics or college is honestly more important sometimes.
Yeah, and I think actually this year I think is a big opportunity for them. They did a big partnership with the NBA Athletic Trainers Association, kind of built around this of like how do we spread the word to athletic trainers across sport, across levels, you name it. Being the NBA Athletic Trainers Association, a lot of people look up to them and okay, what are they doing?
Yep.
Right? What do they have? And so I think that partnership's going to be huge to kind of reach the high school levels, and that's part of the mission of the brand too, like reaching kids at a younger age. Because obviously, if we can prevent it much younger, then those kids are going to have a better career, whether that's professional or not, right? And they're not going to be dealing with pain and injuries as much. I think that's a win-win.
And then can I ask? I'm assuming you guys did NBA because it's probably one of the highest ankle sprain
Yep.
populations. And that's been your focus. And then obviously, I mean, I'm assuming you're branching out to other sports. I know you've got a lot of other sports on that list.
Yeah.
But your focus has been NBA because of it's one of the highest ankle sprain populations. Is that correct?
Yeah, exactly. Yeah, that's kind of the initial focus. Football, NFL, like it was surprising. Athletes responded really quick to it. Baseball had a quick response. And then what was really interesting, and I work with a couple of soccer players, soccer is so unique because those cleats are so small and compact that like ankle braces are just out of the question. If they do anything, it's usually tape, and most tape is like after the first like 10 minutes, whatever kind of protection it provided is not there anymore. And so now we're seeing, as soccer players are starting to get exposed to it, like, oh, this can really help. You'd be surprised, ankle sprain, or you're not surprised, but the listeners would be surprised. Ankle sprains in soccer players are super high.
I like it.
Yeah.
I mean, a famous
I had no idea.
Serena
That's
Williams, she always had her ankles, braces and things like that. So, tennis also is probably a great sport. We just saw Roland Garros where they're running back and forth and doing splits and sliding. And I don't understand how they're not having higher ankle injuries, but let alone maybe on the lower level they are. So that's an interesting sport as well.
I think it's interesting too. You always notice on this podcast, you always said you learned something, right? Well, we learned so much from everybody about these different sports and the injuries. And no matter how much you think this is why, like, getting people on, talking about this stuff, hearing the details, it just really breaks everything down to understand it better, right? It's not just a product. It's like, no, this is a product that's been tested, it's been revised, it's been improved. We're on 3.0. With two more follow-ups, and I want to kind of let you go so you're not being on all night. First one is like, so I know we kind of advertised for the 2.0 initially when I was working with you guys to kind of get this podcast set up. It was a 2.0, now you get a 3.0. What's the difference in the upgrade for the 3.0?
Yeah, mainly the positioning of this little part here at the bottom. So that, like I said, like some players, and I think it's really dependent on the type of shoe that they're wearing, like they would feel like it kind of dug in. And so they move that up and out of the way. So it's just, totally remove that.
But no change in the piston.
No, the piston's the same. Yep. And so that's the same. That's tried and true. So no reason to change that. It's really just creating more comfort around the brace. And they did release the 3.0 is out now. So everyone is getting that now.
Perfect. And then I would say sort of kind of final question. And I know Will's maybe has a fun question or something. Who knows? He's always got something hidden there. What's the future? I mean, we kind of talked about it, but what's the future for you guys? Where do you guys see yourselves in the next 3 to 4 years, or what do you want to do for these products?
Yeah, I think, as we mentioned, like it's definitely going to be some expansion into other joints, protecting other joints. Obviously working with NFL guys, like knees are a big issue. And just linemen, like you said it, MCLs are like, I think it might be the #1 injury for offensive and defensive linemen. And so if there's a way to help protect them, we're going to do it. And so I think exploring what other joints, how much of a difference we can actually protect. You mentioned the UCL in the elbow and pitchers, like, is there something here? We're exploring that. And so I think that's going to be really interesting. And then just generally, like the more adoption, the more people are hearing about it, learning about it, and understanding how beneficial it will be for them, I think is going to be the real focus.
Awesome.
Great. I'll do a 2-part question. When you first came over, right, and I believe you mentioned you came over for the Minnesota Timberwolves, you show up to Golden State Warriors the year after the surgery for Curry. What was the pressure like for you saying, man, I'm coming over here. We know what the bread and butter is for Golden State right now is making sure that we're getting Curry back on the court, changing maybe his regimen. Obviously, he got bigger. I believe when he first came in, he had some hip issues and things like that. So if you could explain some of that. And my second part is, what did it feel like winning a NBA championship?
Yeah. So first part of that question is kind of interesting. So I'll tell you, my first day in the practice facility of Golden State, I joined the team during the summer out in Vegas during Summer League. And then after Summer League, we come in. My first day in, I won't say who, but it was another player who's dealing with a knee injury. And he kind of put me to the test. Like, he didn't tell me what was going on. I didn't know what was going on. And I just kind of like, hey, something doesn't seem right. What's going on? Long story short, he goes, you think I need surgery? I was like, no, I don't think you need any surgery. And he kind of starts yelling, I told you I don't need surgery. I told you. I was like, what did I just, what's going on? So long story short, but essentially he had a small quad tendon tear that the team, everyone's trying to figure out, and they kind of had settled on doing a surgery, and he was going to miss, obviously the beginning of the season. He really didn't want the surgery for whatever reason. And so it's like, okay, I think we can handle this and kind of rehab him back. And so, to be honest, like I was literally like, am I going to get fired on day one? Like, what did I just cause? And so thankfully it all worked out. He didn't miss any games that season, player with the knee, which was pretty awesome. And so to be honest, like with Steph is such a great like dude and a good person, and I think he saw honestly what we were doing with that other player and his knee, and he's like, all right, just tell me. And I tell everyone all the time, I had the advantage of like coming in when they've tried millions of things, and it's like, okay, well, let's look at this one other thing. It's like, let's just think outside the box and see how this helps. And obviously it's a combination of everything, right? Like it's the surgery, it's his work that he put in on the rehab part of it, his willingness to like do what I was asking of him, to try to help kind of change some of his movement patterns a little bit. And so it's everything that kind of made it, like, to me, the Steph part was kind of easy. It was the other guy that I was like, oh my goodness.
Like, on day one.
Yeah. Good test. I will know that from now on. Good test.
Yeah. So, and then winning a championship, I mean, it's incredible. I think you hear a lot of people say, like, there's so much work that goes into, I think any sport, right? Professional sports, like you're in it day in and day out. Holidays, weekends, I kind of told everyone, like when I worked in the NBA, it was like 12 years, 7 days a week. I got maybe a week off here or there, in the off season over that course. And it's just like, you put so much time and energy into trying to win. And it's like one team wins. That's it. Like it takes a little bit of everything to come together. So it was incredible. And at the same time, it's like, okay, what else? How do we get better? And you get like that
next year, repeat.
Yep. And that's the thing about sports. It's like you win it and you celebrate it, and then it's like a couple days later, it's like, all right, let's get back to it. How do we get better? So it's pretty wild.
Last thing, if you had your choice when you win an NBA championship, should you be able to take the trophy and celebrate the way they do with the Stanley Cup? Everybody gets it. You get a few days. You can travel with it, take pictures, put babies on it, whatever it is. How do you think? If you could change one thing for the championship, what would it be? Would it be something like that?
Yeah, man, that's a good question, because I think me personally, and I can't. It's not really fair to speak for players, but I don't think players get caught up in the trophy as much as the fans do. Like for the fans, it's really cool and it's special to like see it, to feel it, to touch it. But I think for the players, coaches, staff, everyone, it's like, it's the work that, it's the memory of like the whole process that matters more. So maybe for the fans' sake, it would be cool to travel around and get it out there. I think some teams try to like show it off a little bit, but yeah, I think for them, for sure, it would matter. I think for the players, it probably doesn't matter to them as much.
Makes sense.
I like it. Listen, thank you so much for your time. As Dr. Garcia mentioned throughout the show, we learned so much. We're really excited about the product as well. It's very unique. It's very different. And all the points that you highlighted, it just illustrates why, players should be using it, but just not only at the professional level, but obviously at the amateur level. We'd love to see some high school kids use it as well, because maybe then that allows them, to not have these injuries, and maybe their career could go a little bit further, because we've seen so many talented individuals never make it to the highest level. So, Dr. Garcia, last words, but Keke, thank you so much.
I can just say I'm going to get a lot of ankle sprains out of this episode. Asking about my Betterguards. Yeah, no, we got to show that off in the office. This is awesome. So anyhow, I love it. Thank you so much for being on. This is really cool. I love the new tech, and anything to help the players and the kids and not have to do as many surgeries is good. So thanks for coming on. I really appreciate it.
Thank you. Thank you. Shout out to Danielle. Thank you, Danielle. We didn't hear from you, but
Thank you, Danielle.
Thank you. Take care.
Thanks.
All right, bye.